I'm not going to belabor this point, but it's very well known that air pollution causes a variety of health effects. Some of these are very short-term effects, such as trouble breathing, patients having asthma attacks, bronchitis, COPD, even patients with underlying heart disease having heart arrhythmias, heart attacks, those type of problems. There's also long-term problems that we know are caused by air pollution. Some of these are respiratory and cardiac as well, but we also know that there are many others, such as cancer and early morbidity or early death. These take decades to develop. Anyone who has chronic disease, chronic lung disease, chronic heart disease, even diabetes, they're going to be more vulnerable to the health effects of air pollution. Older adults, children, and pregnant women are all vulnerable populations. And then certainly people who exercise outdoors regularly, they're going to be breathing in during exercise a higher volume of air into their lungs and have more exposure that way. The pollution can actually cause these distal or further away effects in other organs. Basically, we're talking about very small, tiny particles of pollution. They're very small and you can't see them. You're breathing them in, and they're actually going down into your breathing tubes. And I like to think of the lungs as an upside down tree. So you have a long tube going down your airway and it starts to branch off. And then finally you end up in the leaves, or what we call the alveoli or air sacs. And the air sacs then are just separated from our blood vessels that feed the lungs just by a single cell membrane. So these small particles can actually cross from the air sacs and get into our bloodstream and go to all these distal or distant organs and cause these problems.